Welcome, everyone. My name is Nathan Lowe. I'm a Program Director of Grants and Research Projects at APPA. I have the pleasure of serving as moderator of today's session, Community Corrections Virtual Roundtable on COVID-19, the experiences of individuals under active supervision. I'm pleased to say this is the sixth roundtable that we've had in the series that started back when the pandemic first started. In March, April, well, at least our response to the pandemic started in March or April of 2020. So today, our session involves our constituents and representatives from the state of Oregon, and I'm going to turn over and let them introduce themselves. But just a few kind of just logistical things before we get going. One, this is a fairly informal format. It's strictly a roundtable, meaning that my job is to simply to kind of help facilitate questions to our panelists here. But we'll certainly respond to any questions you have. So I'd prefer you'll see in your in the menu there, the QA section. You can submit any questions there. I'll also be monitoring the chat message box there in case you have any questions or comments, and we'll see if we can respond to those throughout today's session. So, Larry, I'll turn it over to you and let you introduce yourself first.
Great, thank you, Nathan. Good afternoon, everyone. My name is Larry Bennett, and I'm the administrator of the Community Corrections Division of the Oregon Department of Corrections. I've been with the Department of Corrections for about 21 years now, about half of that time within the institutions, and then the latter half with the community-based side. Tracy, you want to take it away?
Sure, sorry. Tracy Dodge, I'm a PO in Linn County, and I currently am responsible for the Linn County Drug Court program. I've been there 28 years. I've supervised intensive supervision. I've supervised a gender-specific caseload, a limited supervision caseload, transitions caseload, and just general street crimes caseload. So happy to be here. Ron?
Thank you, Tracy. And Mr. Ron Hansen.
Hi. I'm Ron Hansen, and I am under active supervision and have been during COVID. I'm 45 years old. I've been justice involved for most of my adult life, on supervision for much of that time, and I've managed to accumulate the longest amount of sobriety that I've ever had, and I'm doing big things, and I'm happy to be here.
Excellent, Ron. Thank you.
Great. All right. Well, I think, it's important just to start. We as I mentioned, this is the sixth roundtable that we've had in this series. We've heard a lot of wonderful, I think, in very passionate stories from our members and constituents in the field on a variety of different topics, all fitting kind of within like, how's your agency responded? How have you individually responded to all of the challenges and adversity that we have faced over the last year? But it's always good to get particular perspectives from different jurisdictions. So, Larry, why don't you just begin by telling us a little bit about, from an agency standpoint from across the state of Oregon, some of the bigger challenges that the pandemic presented to community corrections agencies there, specifically from the with an understanding of how that work involving clients under supervision has been.
Thank you, Nathan. Great question. I don't know how unique the challenges in Oregon will be compared to some of the other states. This has, as you know, been a major event for the last year for all of us. I think when I think about the biggest challenges that we faced, the first thing that I think about is very early on, just simply the accurate, dissemination of information. It was important for us to keep our staff, keep clients, keep stakeholders educated, informed, not just around, the development of the virus in our area and the unfolding pandemic, but what was our response going to be as a community corrections, and particularly as things developed so rapidly. So we were dealing with multiple, often conflicting sources of information, like most of you. So we had to make adjustments on the fly and make sure that we had a way of communicating those adjustments to our clients, as well as to our staff and stakeholders. So that was one of the big ones for us. Another one was moving to telework. Like many of you, if you'd have told me in January of 2020 that our staff would be telecommuting, I would have said you're crazy. This is a people-centered work. So how do we do this work without physical contact with our clients? But suddenly we were faced with the need to significantly reduce the number of staff in the office, the number of clients that could come in. So office visits had to go down significantly. And then all the technology and other challenges associated with that telework piece. Context standards and expectations. We recognized pretty early on as a state that we're going to have to relax the context standards. We're going to have to, in many ways, redefine what a contact is. I mean, office visits, began to be replaced with phone calls and email or texting or virtual as we got better at this virtual environment, virtual visits. Again, it's human-centered work. So how do we accomplish this work without having that regular contact? And then I think a couple of other things. Transportation upon release from supervision was a particular challenge in Oregon. I don't know how that impacted other states or how that played out, but many of our prisons are located in rural areas, and we couldn't move our adults in custody to facilities in the county of release because of outbreaks that were popping up here and there. And so we ended up having to get very creative about the transport of individuals from their prison upon release onto community supervision. And in many cases, we had parole officers from around the state making that trip in appropriate PPE to the releasing facility and picking the releasing individual up and transporting them to the county. Lastly, I would say is general concern and fear about the well-being, not just of ourselves but of our clients. Right? Are they violating with greater frequency now? Are they using drugs? Are they having contact with people they're not supposed to have contact with? And what about the risk and liability associated with those things? What about their quality of life? They were losing jobs, and the reduction in services, depression. Subsidy housing became extremely difficult to find as populations were, cut back by 50% for these social distancing. What about their kids? So all of those general fears and concerns came about. So some of the big challenges.
Chrissy and Tracy, from your standpoint, as a line officer, were there any unique challenges that you faced in being able to perform your duties?
Well, I mean, just like Larry said, we were not used to teleworking. I, in 28 years, have never teleworked. And so it's hard to be a PO from your home. I think that it was also difficult not being in the home with the client, because that's how we are able to tell that supervision is working, right? Like if I'm in your home and that your home is clean and your children are taken care of and there's food in the fridge and you're not having associates that are pro-criminal there, then that tells me that supervision's working. And the opposite of that is that if the home is in chaos and there's people there that shouldn't be there, then that tells me that we need to intervene. And we just didn't have that capability at the beginning. Currently, we're doing home visits, but they're from the doorstep unless we have, can justify going into the home. And then also, I think, with office visits, those were either phone or email or text or FaceTime. And, it doesn't allow for a lot of privacy for the client. So if there's someone in the home that they didn't want them to hear the conversation they were having with the PO, then those conversations just didn't occur. And I think, you're always concerned about the safety of your clients and making sure that they are able to be authentic and honest. And so, that didn't occur. So, I would say that those were probably the biggest challenges for us. We obviously weren't getting urine samples at the beginning, and so there was really no way to determine if people were being honest about their drug use. So just, a lot of challenges at the beginning. We've kind of been able to work through some of that, but initially those were definitely some concerns.
Absolutely. And Ron, from your standpoint, what Tracy was saying in terms of being the challenges of home visits, what were you, from your experience, what were some of the challenges that you faced as someone under supervision?
I had kind of a unique situation because I am a drug court client. So when I was released from jail just at the beginning of the new year last year, I actually was released and put into a clean and sober home where many of the clients there were people that I was in drug court with. And my PO, Dave Sparks, is the drug court, parole officer. And I think I was very fortunate that, he always, communication was always like at the forefront. He made sure to communicate with all of us very well, and we were all in the same house, and these are all people that were in drug court with me. And so, I don't think that I really had the same challenges that maybe some people that were, that aren't in drug court may have had. But for sure, in the beginning, especially without the contact, the face-to-face contact, and the home visits and the UAs, I think that because I've talked to a lot of people during this time preparing for this, people in drug court and my peers who are just on supervision, and there have definitely been a lot of a lot of relapses and a lot of there's just I think the loss of accountability there. Knowing that people knowing that they're not the likelihood of them not getting UA'd and not having home visits definitely contributed to a lot of that. And so I think that was definitely an issue, and I'm just thankful that I was in the position that I was in. I guess
Great.
That's it.
Yeah, Ron and Tracy both talked about communication and how important that was. And I think we've all seen within the field there possibly going to be some changes post-pandemic that remain in place, and how we communicate. The communication between an officer and a client very much could be among those types of changes. Larry, can you talk a little bit about that? Like what you all have already started considering some of those post-pandemic changes in terms of supervision practices?
Yeah, I think we certainly would continue to explore the benefits of the additional channels of communication with the clients that we have. Necessarily be limited to an in-office visit, right, or a phone call. I love stories of treatment or visits happening in a virtual environment like this. So I think we'll certainly carry on with that, and a little further. We've spent quite a bit of time in Oregon, at least, talking about the idea of telemedicine. So using this kind of technology to provide treatment and services to folks that are living in outlying areas. And so, I think that the new experiences that we're beginning to get comfortable with, that were forced on us initially, are going to benefit us in the long run, certainly.
Tracy, same question to you, but from like a PO standpoint, what are maybe you mentioned, the challenge associated with not teleworking after 28 years in the field. Like, are there certain aspects of or changes that you had to take that you see that you may be useful to keep around or continue doing post-pandemic? Tracy, you may be muted.
Sorry. I do think I probably had more contact with my clients in over the last year, just because I was able to pick up the phone and call them and email them and FaceTime with them. And I'm also the drug court PO, so I attend court with my clients still in person. So I'm seeing them weekly. I'm doing it virtually at Drug and Alcohol, but my clients are there. We've also had drug court meet in the park, and we've social distanced, and we're able to, conduct our graduations and our sessions there. So, I mean, we've tried to be a little creative in how we still can interact with people. I mean, I personally think still face-to-face in person is just the best. It's just the best way to gauge how somebody's doing, what their home life is like. Again, it allows for some privacy, so you can have some conversations that they may not want other people to hear. And so I'm always probably going to advocate for the face-to-face in-person contacts.
Yeah, let's hope that never goes away, for sure.
Yeah, right.
Absolutely. And Ron, what about, did you also have a similar experience? Being able to see your officer more often or have more communication?
I know that, there's been a lot of changes. Oh, I'm getting an echo.
Everybody muted?
But so we've been back and forth as far as like the face-to-face stuff. Like in the beginning, of course, there was no, we went to all virtual stuff and phone calls, and then because I'm in drug court, once things they're in the middle, we went back to where we were able to go back into court. And so we would see our PO and like our peers there. And now it's back to, telephonically, which, I don't prefer, but it is what it is right now. So it's definitely been challenging as far as like, I would much rather, there's been the communication face to face with my parole officer recently has been pretty non-existent. And some of that I think is because I've moved forward into, with drug court, there's phases. And I think that he's been focusing more on, the people that are coming into drug court, much like he did with myself, and which is understandable. I think that he considers us who are further ahead. I'm in grad phase now. And so, I think he feels that we're a little bit more responsible and in a better place to where we don't have to be supervised quite as much or need that much supervision, I guess, which is understandable. But I would sure like to get back to face to face, like as court, in court, and seeing my peers, and it just makes a huge difference.
Absolutely. Yeah, Larry, Tracy, I was wondering if you could talk more. I think everyone has mentioned about, the use of telehealth services, and how that has been. I've been particularly curious to what extent, those type of services have been used for clients, and have they, from your all's experience, been fairly successful in light of not being able to, physically be with one another to provide counseling, treatment, or any other type of service?
Yeah, I think, as Tracy mentioned, face-to-face is always best. I mean, we benefit from body language, we benefit from privacy, we benefit from, lots of things that we certainly don't get in the virtual environment. That said, we have individuals that are living in outlying areas that need access to some of the professional services that we simply have a difficult time finding in those places. And so, while I would agree it's not the ideal or the best, I think it's important that we do what we can to ensure that those folks that live in those outlying areas have access to some form of help. I know from my perspective, over the last year, I've gotten a little more comfortable with this environment, this virtual environment, but it certainly cannot replace, sitting in a room with all of you or having that kind of contact. In terms of successes of possibly using that, I'm not entirely sure. I know that we have some folks in Oregon that are looking into that and looking into piloting that so that we can begin to measure on our own. How is this working? Is it better to have this than it is to have nothing? And certainly, it'd be hard to imagine that this virtual environment would have advantages other than being able to reach those that are in more difficult areas to serve. It'd be hard to imagine that tele environment would have any other advantages over the physical contact. Anything you want to add, Tracy?
We were in a unique position because our treatment program didn't really change. They still continued to have in-person sessions. We were really successful in reaching out to community partners to help us kind of continue the resources that we wanted to use. So we were able to contract with an agency that was willing to get UAs for our drug court clients. We were able to contract with agencies to mentor clients still. We were able to reach out to different agencies so we could, in lieu of sending people to jail as a sanction, because as most of us know, jail was kind of not an option for a lot of us because of COVID and numbers reduction in jail beds. So we were able to reach out to people for like work crew opportunities. So, I mean, I would say that we were really successful in utilizing the community partners, and they were just so awesome about like filling the needs that parole and probation couldn't fill perhaps, or even our treatment program couldn't fill.
Great. You all also talked about how important it is, and Tracy, you mentioned a moment ago about how you felt like you've been able to talk more and interact more to some extent with clients, and I think we all know, since it's been mentioned already, I think more than a couple of times, about the technology will never be able to place that in-person direct physical contact. So it makes me think about how important the quality of interactions are. And so could either one of you all talk, and Ron, feel free to talk about how important it has been in making you realize that the quality of interactions that you have with each other can help be successful, particularly in times where there's very significant challenges, a lot of adversity, and without that, you see more failures than successes.
Well, as far as my caseload goes, I am the drug court case PO, and so initially we did not have any face-to-face contact, any in-person contact for several months, and then after that I started attending their court sessions with them in person, and of course that was virtual with our judge, but we were able to social distance at treatment so that I was able to continue to maintain some face-to-face contact with them. And I mean, I can tell you, I think they really appreciated it. I mean, the days that I was not present for whatever reason, they would ask where I was, and it was kind of their opportunity to talk to me in person. And we were able to, like I said, still have their graduations in the park, and they could bring their families. And so I think it's healthier for them to actually see their PO face to face and know that we are still here, we're still supporting you, we're still going to hold you accountable as well. I just think it's so hard to supervise via phone or email. I mean, it's just so much more beneficial for them. And, you know, this was a challenging time for them as well. I mean, we are all professionals, but they don't necessarily always have the skill set and the coping skills that we as professionals do. And so they really needed to have someone there face to face, encouraging them and supporting them and providing them resources and making sure that those all those resources were still available. And so I just think I was like really fortunate to be in the unique position to be able to still do that with that drug court caseload, because a lot of general caseloads just didn't have that opportunity. So I mean, I would say that I think that that was really beneficial for my clients. I would hope that they would say the same thing.
I would just like to say on that kind of on the flip flop of that, as a drug court client and just someone on supervision, I have noticed one thing over, like, as I think about being on supervision in the past and office visits and how limited they were. They were usually fairly hurried, and not a lot was discussed, you know, on like a personal level, or, you know, it was pretty matter of fact and like in and out. And I have noticed that over this last year, the relationship that I have with my parole officer, I feel like has formed into like I feel fairly comfortable talking to him. We've talked enough and emailed enough to where I think that I'm able to like have a little bit more of his time and attention, and which is kind of strange, but I mean, not so much, but that's just something that I was thinking about. And like we tend to have longer conversations and more in depth about what's really going on, and I feel, I guess, more comfortable doing that, like on the phone, or, you know, even like, I don't know. I just wanted to make, this is just a thought I had.
Yeah, certainly. Yeah, now I was going to ask you about that. Why do you think, Ron, and why do you think, is that because you know, you just, and I think your story, your experience there would probably resonate with a lot of people, in that it's a little bit more comfortable sharing certain things, you know, over the phone or by email. People, you know, can be a little bit more vulnerable about how they're thinking or feeling or what's going on in their lives. And, you know, without the pressure of being in an office and feeling rushed, and, you know, so is that what you would say some of the reasons were?
I think that definitely, both of those things are definitely a factor, but I also think just over like, there's been a lot of, like over this time, you know, there's been a lot of communication, you know. I was very fortunate to have a parole officer that has very, you know, he's been very good at communicating throughout the whole thing, about changed policies and about, you know, just about keeping us informed about what's going on. And like, you know, even in the beginning, he would just like weekly, he would have like questions for us, you know. And so we built a pretty strong relationship as far as like, he just, he's made it comfortable for me, you know, just, and like, I genuinely think that he, you know, he definitely cares about the well-being of, you know, his clients, and it just feels like that. So definitely those things contribute, though. I mean, it's easier for me to talk to somebody if I'm not like, you know, facing like in the office, like you're saying, and feeling rushed, and like that definitely is a contributing factor.
Nathan, I would just add that, you know, what I'm hearing both Tracy and Ron say is that regular contact is important. And, in someone's recovery. And, that contact can't always be physical, which we would all agree is probably the best face-to-face. But, I think the more ways that we can supplement these other forms of reaching out, whether it be email, I think that I hear Ron saying those connections, although I didn't see him face to face very often, those touch points increased. And I think Tracy said the same. And I think that's helpful here.
Well, that kind of brings me, and we've talked a lot about the positive things that have occurred in response to people being resilient and, what about some of those things that the lessons learned, maybe mistakes that you made or decisions that you made early on that you realize, this is not really working. And while we may do it temporarily, we don't envision it sticking around.
Nathan, I think that's an interesting question. As I've thought back about how Oregon has responded, and I would never give the impression that everything has gone smoothly. It's been a painful experience, and at every turn at some places. But I'm not sure that we will completely abandon, at least in my awareness of the operations, completely abandon any of the changes that we've seen in its entirety. Other than, of course, we'd like to see the masks and the plexiglass dividers and all of the virus-specific stuff go away, which is also, by the way, as we know, a barrier to good communication. I certainly don't anticipate that the Department of Corrections or that the parole and probation officers would be continuing the practice of providing rides upon release from prison. That has been a very interesting challenge. But other than that, I think as I look back, it's been a positive experience. Now, granted, I'm speaking from an administrator level. I'd be very interested to hear what Tracy would have to say. And Ron, I think that going forward, we're likely to see a hybrid, really, of how we operated before COVID, and then how we've operated for the last year. Tracy, what do you think?
I mean, I agree that I think that I was impressed with how quickly we were given the equipment to do the job from home and given the directives on the teleworking. My supervisors had us, just so that we could kind of elevate the visit with the client. He wanted us to have more meaningful contacts with the clients, and so we would do carry guides and bits, and I would email homework and they would send it back. And so I think in that respect that actually worked pretty well, because then I wasn't sitting across the desk from somebody and they were having to answer these questions quickly. It kind of gave them an opportunity to do it on their own time and then return it to me, and then we were able to go over it together. And so I think things like that could still be done, via telework or via email or text or whatever. But I mean, I think that our agency did pretty good as far as like trying to come up with some pretty creative ways to still supervise people, even if it was in a parking lot or in a park. I mean, I think that we did the best we could, and I would say that we did a pretty good job on like still maintaining contact and trying to see clients and hold them accountable and being creative and using community partners.
Nathan, I would just add real quick that we have the benefit of really strong relationships with county directors, community corrections directors around the state. And that partnership, which has been in place for years, benefited us greatly as we began to have to deal with communicating information quickly and accurately, and responding. So we're grateful for those relationships that we have with the local system.
Ron, would you like? That's great. Yeah, and I've heard that time and time again, Larry, in terms of the importance of communication, particularly among leadership. During this time, without that proper communication, that usually yields confusion, lack of transparency, which just creates more challenges. But Ron, I'd like to get your thoughts on, not necessarily from the standpoint of things that would change different, but can you talk about maybe one experience that you've had over the last year that was probably the most challenging to you, and in terms of your supervision, and maybe could have been a little bit differently if how the changes as a result of the pandemic hadn't occurred, that would have been a little bit easier to process or do, or anything along those lines?
I'm trying to think. Probably, I mean, really the only thing I can think of is like, I mean, there's been a few hiccups and like challenges, like especially in the beginning. And I think the hardest thing was like just getting, like when we initially started, like we were trying to do Zoom, and like the technological aspect of it, there was some challenges there, and it was frustrating. And like I was living with a bunch of other guys who were also in drug court, and everybody was extremely frustrated. But that all got ironed out eventually after trying different things. And but that's probably what sticks out the most, is that initially, like in the beginning, when it was all new to everyone, and it was just kind of thrown at us, and we did, nobody could connect, and nobody, like, it was just like, for whatever reasons, there was always something that was going wrong, it seemed like. And like, so it was super frustrating because none of us wanted to, we were feeling like, well, we didn't really know, are we going to get in trouble because we weren't able to connect, or like, and so like it was nerve-wracking, but we got through it. And like we just, they were flexible, and they just, we worked it out as we went, kind of together. So
Great. And Ron, you're certainly not alone there. I think we laugh, among our team at APPA, how we didn't even realize that we had certain technological resources available to us until the pandemic, and then there was kind of a learning curve associated with that. So I wonder if you all could talk about, and Tracy, this may be a good question to first direct at you, but we saw many families, whether they were involved in the justice system or not, experience a lot of financial hardship, and the difficulty that caused on them, and particularly if they had small children, and that were already a pre-pandemic struggling anyways. Tracy, could you talk a bit about maybe an experience that you had with a client in terms of financial hardships, and how they were able to get through, if at all, what resources that you all had available there in the state to help in that regard?
Yeah, I had a gentleman in drug court who he was the sole caregiver for his 2 young children, and he was initially living in an Oxford house with them, and just that's not really suitable housing for young children, especially a young daughter living with in a house with men. And so we were able, we utilized Lynn Benton Housing Authority, which is, a housing authority we have here. And we were able to get him housing through them. And then he has since graduated with the program and was able to maintain housing on his own after some period of time. But yeah, we utilized a lot of resources. We were able to get him, furniture through Lynn Benton Furniture Share, and we got him hooked up with his school, and they have a program there for school supplies and clothing, and then of course the housing through Lynn Benton Housing Authority. And so I think, luckily with a team approach, you're able to kind of put your heads together and figure out a lot of different resources for people. And I think we were able to come through, at least for him. I don't have a general case, so it's kind of hard for me to speak to maybe what general caseload POs were doing, but those resources are available to everybody. So, and there's a lot of COVID assistance through like our local community services consortium for rent assistance. And so I feel like they kind of did okay on accessing the resources as long as they had someone to help kind of navigate some of those programs.
Larry or Ron, you'd like to speak to that? And that, I mean, I don't know, maybe from your standpoint, Larry, being in an administrative role, you know, kind of continue on what Tracy was mentioning in terms of the resources available to help people who are been, you know, struggling financially. But what have you seen? You mentioned leadership among the county directors, but were there any other organizations or resources, particularly at the state level, that you saw really benefited people under supervision during this time?
Yeah, you know, our one of the takeaways for us is that the stakeholder group involved in successfully, you know, transitioning and helping these folks on supervision be successful is much larger than we had previously understood. We've benefited from a number of solid relationships with Oregon Health Authority, for example, and the local public health authorities in the various counties. A number of local and nonprofit agencies that assist with everything from transportation to an appointment to clothing to on and on and on. And there's some exciting conversations going on, particularly around having health coverage. So when you're incarcerated in Oregon, during the end of your incarceration, we will sign you up for the Oregon Health Plan. But that health plan doesn't become active until you release, and the client has to go out and make an appointment with a physician and all that sort of thing. Well, having the public health involved and Department of Human Services, their eyes are open now to the challenges that these individuals on supervision can face, particularly during a time like COVID. And so some really exciting conversations are happening around how can we make this smoother? How can we further assist these individuals on supervision to achieve success? And the thing that stood out to me that Tracy said is, the answer really is in that team collaborative approach, right? No one entity, no one person can do every aspect of this work well or even effectively. But if we can work together and particularly continue to develop these local and state level relationships that have come out of this past year, I think we're in a really good place going forward. It's exciting.
I know that for myself, as far as resources, like there's been numerous people that I've known over this last year that have been in recovery and that have children and with and without children. There are a couple, there's a lot of agencies, luckily, in Douglas County that help with housing, low income housing, and housing for children and their mothers, but fathers, clean and sober housing, like UCAN, the United Community Action Network. I know that several families who have been helped, obtain housing that were in similar situations that Tracy was talking about. A couple of them were with their children in Oxford, and they helped them transition, during this time into, their own apartments or housing. I've also utilized the employment department, and vocational rehab has helped me. And there's just been a lot of resources that I wasn't even aware of that have come about, I think, because and been kind of thrown at the forefront. Like they've been put out there for us to utilize that we might not have known about before. And so I think it's been good for that. And there's definitely a lot of resources down here. And I think a lot of us are very grateful for that.
Absolutely. Tracy, you mentioned a moment ago, being involved, being a PO in drug court. We've heard also that, and we know it's not a matter of we just heard what we know, many jurisdictions across the country relaxed on some violations or imposing sanctions on certain violations. You mentioned a moment ago about drug tests and other types of ways that have been typically used in supervision to monitor clients' behaviors. But from your standpoint, were there any violations that were a little bit relaxed, and if so, have they now been changed, or what's the thinking or the practice around that from your experience?
Well, over the past year, our jail beds have been reduced, and so jail has what was once kind of one of the first things that I think POs and judges go to. We just weren't able to utilize that, and so we didn't overlook any violations. I think we still responded to everything. I think it's just really important that you always respond to every violation you know about. We utilize GPS a lot, which is fairly new to our office, and that was really helpful. We also utilized just a house arrest where they actually didn't get hooked up on the bracelet, but I would call periodically throughout the day to make sure that they were home, and they had to be, in their home every hour of every day for like 7 days. We utilized a lot of work crew, and again, we had to rely on community partners to come up with work crew sites for that. We utilized we almost established like a day reporting center where we found one of our community partners would allow them to come and sit for the day, and they had to just work on their court homework. Day planners. I mean, we just kind of tried to come up with whatever we could come up with as an intervention that didn't include jail. I mean, since in the past couple months, jail has opened up a little bit more for us, but we've actually found that we're not even really using it as much as we were before, because we have been able to come up with some other kind of interventions that seem to be working. I mean, the GPS and the house arrest really have been pretty fantastic interventions for us. And so, just trying to, manage violations that way. But I would say that we've really maintained holding people accountable. I don't think I haven't seen anything kind of get slipped by.
Larry, anything to add to that in terms more at the administrative level in terms of policies or violations?
I think it's always helpful to think outside the box, right? We should always be pushing forward and looking for better ways to achieve what it is that we want to achieve, the success of a client on supervision, the successful termination of the supervision. And so it's important that we get outside the box. We're not real good at that typically in corrections and criminal justice, right? The way to maintain safety and security is to do things the way we've always done them, and change is scary, and I think more so than other agencies. I think that I think it's been good for us not to be able to rely on a jail sanction. I think that jail sanctions in general, likely nationally, are relied on perhaps more heavily than they should be. And as Tracy was talking, I was wondering what Ron's perspective is on a jail sanction, and as opposed to some other kind of intervention that might be given. So I wonder, Ron, would you be comfortable talk to us about what a jail sanction means to you as a client? I mean, does it have the impact
we kind of talked about this a little bit, and it's definitely, I know that for myself, being in and out of corrections for so many years, and doing, I've been to jail so many times. I've been to prison twice, and it's jail for many of us, and I can speak for a lot of my peers on this, because I've talked with them, and it's not really a deterrent. It doesn't. It's kind of like a lot of people are just consider a little break, and it's not really beneficial. And if anything, those of us that do have jobs could possibly, lose employment, or and I think it doesn't do a lot of good for some of us. It's definitely not a deterrent for someone like me that was going more frequently than not. And I definitely I like we've utilized, like in drug court, we have some alternative, we do a lot of work crew, and we also, like, depending on the violation, maybe it's a tailor-made homework assignment, or like something like for a violation like I had recently, unfortunately, for some missed UA call-ins, where I just spaced it and I didn't call in on time. 30 days of call-ins by 8 o'clock, which makes me, accountable. I have to have these calls in by 8 o'clock every day for 30 days, on top of 2 days of work crew. And like, where normally that would have been probably a couple of days in jail, or, and I just think it's more of a pro-social, it's proactive, pro-social, and it's like just more beneficial, I guess, because jail isn't really a deterrent, not when you've been going for so long and so frequently. It's 3 hots in a cot, and like a little rest, and a little break. So that's my perspective on it.
I appreciate your honesty, Ron. I think everybody will agree with that. We're getting close to wrapping up, and then of course we'll respond to any questions that any of the attendees have for our panelists. But Tracy, I'll come back to you. You mentioned, you talked to some extent about some of the creative ways that you have found in working with clients over the last year. Can you mention, and you may already have, but can you, if you haven't, or expand upon, maybe what was the most creative thing that you did or your colleagues did over the last year that helped you kind of resolve an issue or work through a challenge?
I think, absent what I've already talked about, I think probably, one of the most creative things, and this isn't super innovative, so it's not like I'm, going to blow everyone's mind here, but I think that we have a PO that conducts his office visits in the parking lot, and he actually has a desk set up, and he has, his social distancing and his sanitizing, and he's able to do his office visits that way. He wants to see them face to face. He sees the value in that. And so we're not required to do that, but that has worked for him. And so, I think that takes some dedication. I think, and for us, I do a contingency management program with some of my clients. And so, we've set up a treatment room with the plexiglass, and we've been able to continue to utilize, rolling out that program. Again, nothing super mind blowing. I just think that, we're all trying to do our best here, and still supervise people effectively, hold them accountable, and help them change through this whole process and support them through this process. Because again, it's just been so challenging for everybody. So yeah, I wish I could come up with something better than that, but that's kind of all I got.
No, the office in the parking lot is pretty good. So.
Yeah, right.
It's pretty creative. Larry, you've also talked about this too, in terms of, kind of removing away from the status quo of conducting business. and how that's been and how that's kind of reshaped your all's at the administrative level thinking about, what can work and what has worked. And maybe could you talk a little bit about how that change in thinking at your level of seeing, as community supervision in operation has got you to think about even in terms of like quality assurance or evaluating the agency's performance or staff performance differently now than you had probably in the past?
Yeah, good question. I think as things begin to, dare I say it out loud, slow down here, COVID-wise, we are really excited to do some sort of Monday morning quarterbacking on, we spent so many months, and in some ways we're still in it, just nose to the grindstone to keep the system operating. And so, we're looking forward to doing an after action report, so to speak, getting the players together. What practices did we incorporate that were extremely effective and could be used maybe in ways that we haven't considered using them, and what other practices weren't so helpful. I think that oftentimes as an administrator or up in the central office, so to speak, we often come up with these great ideas that are hard sometimes to implement. And so what's been so good about this experience, or maybe not even practical or realistic to implement, but what's been so great about this experience is that all levels of the organization have been involved, and all levels of the organization have had to think outside the box. And I think it's surprised really all of us. I've been amazed at some of the things that that our staff and other parole and probation staff across the state are doing. I was, the ability to problem solve as a system and communicate effectively and adapt rapidly was really put to the test by this. And I think we did well in the end. Again, not perfect, but we did well. So I think the exciting thing, again, is that all levels have been involved, and we're looking forward to sort of picking the brain of our frontline staff and having some in-depth conversations, both with county directors around the state, as well as parole and probation officers, about what can we take away from this that ultimately helps us achieve that goal of successful transition from supervision.
Absolutely. And I'm curious, did you all have any type of guidelines or resources in place in respond to something as serious as a viral pandemic?
We did, or at least we thought we did. You can do, we've done lots of table exercises, probably like a number of other states. And in many ways, we had some of the things that we had put in place worked, right? We had an agency command center. We knew what that was going to look like. We knew how information was going to be disseminated. But like so many sort of textbook experiences, when you are actually in the midst of it, you can't just rely on what you have typed up in this booklet. And I was grateful that we had spent a lot of time preparing for something like this, and I'm confident that it benefited us. But I at least was somewhat surprised at the fact that it wasn't as easy as pulling out the manual and say, what do we do next? This was on the fly decision making, ultimately strengthened the team. But we thought we were pretty well prepared.
And Ron, I'll come to you to see if we can, and folks, feel free to submit any questions to the panelists. But if not, we can kind of conclude with Ron. Could you talk, any kind of anything else that you'd like to share in terms of your experience over the last year that you think would be beneficial for other probation and parole officers who are witnessing this right now, for them to know in their experiences and interactions they have with their respective clients?
It's something that's already been touched on, and that I think it's probably the biggest thing. We talked about it in the beginning of this, and I think because I don't know how other POs have operated, but I think that the communication that between my PO and his clients and my peers in the beginning of this, I don't know what I mean, because everybody was pretty freaked out and didn't really know what was going on. And that weekly and almost for a while there, it was like every other day in the beginning, he would reach out to us and he would give us homework assignments, and that communication, just keeping us engaged, during that time, especially in the beginning, I think was so important to a lot of us. And I just think that was probably the most important thing throughout this whole thing, is the communication that, and he kept us in the loop and made us, we weren't left to go, what's going on, so, when he knew stuff, I honestly felt like that he was passing that on to us. And so it made it not so, unnerving or scary or, so I just think the communication thing, I'm just thankful that I had that, and that, that's all I got.
Nathan, before we get into questions, I just would like to publicly commend Ron for the hard work that you've put in. You're on a difficult path, and this past year has made that even more difficult. But you have hung in there, continued to fight the fight, continued to reach out for the help. The relationship, I would argue, that you have with your PO is your responsibility as well, right? It's a two-way thing. So you have obviously been receptive and been interested in maintaining that connection with him. So I just want to commend you for that hard work and tell you to keep it up. And having attended many APPA conferences, to be honest, it's hearing from folks like you that are the most meaningful things that I take away from these experiences. Thank you.
Thank you. I just hope that, I hope I contributed in a beneficial way. I mean, I appreciate that I was able to attend to this. Thank you.
Absolutely.
Great. Well, with that said, in about 10 minutes left before people need to, I know there's a number of committee meetings occurring in about 10 minutes or so. I just want to appreciate everyone's attendance today and our panelists. Great job. Thank you for sharing your stories and your experiences. If people are interested in contacting the panelists individually, certainly you can do that through the platform here. And if not, then and if you have any other questions directly for me and APPA that I could forward on to them, my contact information is on the APPA website. So again, thank you everybody. Larry, Tracy, and Ron, appreciate your participation today, and I want to wish everybody else a great conference for the rest of the week.
Thank you.